First and foremost, thank you all for sticking with this talk. Looking at the programme, we've got next door, how can smart materials and microelectronics be used to create living jewellery? That sounds rather good. This would be the equivalent of sticking with BBC Four when Strictly comes on. So thank you very much for coming along this evening. I have been part of the V&A Dundee team for over 4 years and have a passion for making this museum work really hard for people living with a range of social challenges. Far from being elitist, how can we show that culture is a beneficial resource for everyone? If the title of this talk was any of a clue, I believe the answer lies in repositioning museums as hospitals. Ones that improve our mental health, just as hospitals improve our physical health. Around 1 in 4 of us will experience some form of mental ill health each year, including 850,000 children. As a result, doctors treat around 6 million people per year, and a third of all GP consultations are related to poor mental health. Neuropsychiatric conditions are rapidly becoming the greatest cause of death in the developed world. Treating poor mental health costs the UK government an estimated £77 billion each year, more than is spent on tackling crime and enough to double the national spending on education. This comes at a time when the role of the museum is changing. Traditionally, museums were gated communities. They're objects the preserve of collectors, scholars and scientists. Now, as well as caring for their collections, museums must take on a new remit, that of the care of people. It would be naive to simply assume that visiting a museum will cure depression. However, as the causes of poor mental health are so broad and often non-medical, their solutions ought to be broad and non-medical too. Museums need to play their part and be aware of the soft power that they can wield. Museums can play a role in physical health too, from hosting early morning yoga classes to thought-provoking exhibitions about how we can live better, such as Bodyworks at Glasgow Science Centre or Fit for Life at the Portland Basin Museum. Even at the most basic level, these often labyrinthine buildings offer the perfect excuse to go for a walk. Within the V&A's 7 miles of galleries, who wouldn't swap a wet, cold jog round the neighbourhood for a gentle 2-hour stroll that takes in millennia as rapidly as it sheds calories? However, all museums, large or small, can try to operate like another major civic building. Just as hospitals are optimised environments, well-tuned machines for improving physical health, museums, for the most part, are designed to make you feel better in every other respect. There is no question of a hospital's place or value in society. Would there have been the same outcry if it had been 350 million for our museums on the side of that bus? Imagine if museums reached that level of social acceptance. Currently, no matter how popular, museums are still predominantly seen as shiny additions to the real hard work of a city or region. From 2018 to 2019, NHS Tayside had just over 90,000 admissions to its hospitals. Over the same period, V&A Dundee had over 900,000 visitors through its doors. If every one of those visitors was, consciously or unconsciously, improving their mental health, and most importantly, we talked about it in those terms, what would that do for the perception of a museum in society? It is a well-documented fact that participating in cultural activity can improve one's well-being. Projects such as Museums on Prescription, run by UCL, or Arts on Prescription, led by charity Arts and Minds, demonstrate this clearly. Evaluations from the latter showed in participants a 71% decrease in anxiety and a 73% fall in depression, while 76% of respondents said their well-being over the course of the project had improved. In places, the boundaries between museums and healthcare blur further still. A study by UCLH showed that using the arts in healthcare settings reduced blood pressure, heart rates, and the need for some forms of medication. Capitalising on this, the Wallace Collection in central London has a dedicated programme that takes objects, talks, and creative workshops into hospitals. Challenges such as coordinating activities around meal times, ward rounds, visiting hours, finding materials that could be used in such a clinical setting. For example, in the paediatric isolation unit, everything had to be washed with chlorine. And resistance from senior figures unsure of this approach all had to be overcome. Despite these challenges, in 2018, the Wallace Collection ran 89 different events that reached over 738 people in elderly care units, paediatric wards, mental health support units, and oncology wards. They also trained NHS staff to use their collection to support people they care for, similar to Manchester's Culture Shots programme. In Wakefield, you can visit the Mental Health Museum, run by NHS South West Yorkshire Partnership. Opened in 1974 as the Stephen G. Beaumont Museum, it focused on the history of the Stanley Royd Hospital, better known as the West Riding Pauper Lunatic Asylum, that opened in 1818 and grew to become the largest mental health provider in West Yorkshire. As visitors to the museum dwindled, in 2010 it was only open one day a week. Its audience reduced primarily to medical professionals and researchers. In a climate of austerity, the question was asked, why have a museum? The NHS Foundation Trust felt it needed to do more than just tell the history of a hospital. So a working group of service users, carers, and trust staff was established to reimagine the museum as, and I quote, a place to break down barriers to wellbeing, combat mental health stigma, and be active in social justice. Meanwhile, in South London, the Bethlehem Museum of the Mind is similar. Opened in 2015, it sits in the grounds of the Bethlehem Royal Hospital, founded in 1247. This was the first institution in the whole of Britain to specialise in the care of the mentally ill, and the museum offers a programme inspired by its work. Both museums aim to showcase the history of mental health in the UK and use this in a proactive way to improve the population's health today. On the 1st of November last year, Montreal Museum of Fine Arts and Médecins Francophones du Canada piloted an initiative thought to be the first of its kind in the world. Taking the concept of a museum on prescription literally, physicians can issue up to 50 prescriptions per year for a free visit to MMFA's collections, exhibitions and objects, something that normally costs $24, as an alternative to the more traditional treatment options, many of which can come with unwanted side effects. The project is described as offering free admission to a safe, welcoming place, a relaxing, revitalising experience, a moment of respite and an opportunity to strengthen ties with loved ones. Put another way, a museum won't cure cancer, but it can stop you thinking about it. However, this project aims not only to support patients, but doctors too, by moving towards non-clinical forms of care that can save huge amounts of money. Thus, the museum is an integral part of the healthcare system. These and many more, the Whitworth in Manchester, Horniman in London, Yorkshire Sculpture Park, Glasgow Museums, Bristol's M-Shed, National Portrait Gallery, are also doing incredible work. Interestingly, a report by the Cultural Learning Alliance showed that people who had simply attended a cultural attraction in the previous 12 months were almost 60% more likely to report good health than those who hadn't. If this is the impact from simply walking through the doors, imagine what could happen if museums stepped up a gear. Many of us will know that visiting museums and galleries makes us feel good, even if we can't quite put our finger on why. If museums can support people in more tangible ways, it will allow society to see just how important museums are and how they can be for everyone, regardless of age, ability or interest. At V&A Dundee, our building's light-filled interior is the architectural equivalent of letting out a deep breath. In the morning, the smell of fresh coffee wafts up the stairs and shafts of low sun gleam into the museum, making it feel more like a welcoming, cosy home than a large civic building. Our exhibitions and galleries offer the opportunity to step out of your world, if only for an hour, and see things either in quiet contemplation or share new things socially with peers. The programmes too have been designed to offer everything from a gentle introduction to playful exploration, curious questioning and vigorous debate. Much like many museums, we also have materials that can leave the building to support residents, patients, carers and staff in multiple venues across the local area. In a recent report titled Museums of the Mind, Culture Unlimited stated that mental health and emotional well-being are important to the future of the nation, and museums have a serious and significant role to play. In 2008, it was said that the focus of the NHS should be prevention just as much as cure. So currently, with a health service stretched to breaking point, what role can our museums play in both sides of the equation, the prevention of poor mental health and the cure for when things do go wrong? There are currently around 2,500 museums in the UK. Incidentally, that is twice the number of hospitals. Around one museum for every 26,000 people. Imagine if each one offered some form of support, be it running a huge multi-agency project to prescribe creative activity to those in need, or simply opening their doors after hours for a safe space for people to share their worries. Could every GP ask their nearest museum for exhibition tickets, or direct patients to their local gallery as a form of support? Could community health teams hold a surgery in the museum to provide an alternative to the dispassionate banality of most clinics? Could museums make clearer links between their diverse collections and mental health, thereby catapulting the conversation into a new public forum? A change in how people see museums will only come as museums take on this new role. However, this role will only be embraced if perceptions start to change. Museums must be brave to do things differently, and everyone needs to hold them to account. With services being cut and funding stretched, collaboration, but ultimately integration, is key. We are always told that museums need people. We need visitors to keep the doors open. We need donations from visitors to run our programmes. We need people to attend our events, and we need high-profile stakeholders to champion the work that we are doing. But the reverse needs to be loudly shouted too, that people need museums. I hope, if anything, this short presentation has encouraged you to see the latent potential across all our museums, art galleries and heritage sites just waiting to be unleashed. Thank you very much.